This video talk is going to be about sleep apnea. In simple words of explanation, sleep apnea means breath holding spells during sleep. So this can be seen in adults as well as in children. So in this video, we are mainly dealing about sleep apnea in adults. Now, what is sleep? See, sleep is really a mystery. Still, we don't know what is going on when we are in a state of sleep. So in simple definition, say simple common man's definition, sleep is nothing but absence of wakefulness. Scientifically, if you want me to define sleep, it is defined as a state of behavioral silence with elevated threshold, arousal threshold, that is sleep. A normal person needs 6 to 8 hours of sleep. And when he goes to bed, when he goes into sleep, the sleep we have different stages starting from N1, N2, N3 and he goes into deep sleep which is called as REM sleep. So, each stage he spends particular amount of time. So, if you see N1 he spends about 5% per hour. Likewise, from N1 he goes to N2 where he spends about 55%, that is a majority. From N2, smoothly he goes to the N3 stage where he spends about 20%. And this N3 is a stage when he starts dreaming. Now, from N3, he smoothly goes into NREM sleep where he spends about 25%. And after he finishes off 25%, the whole cycle repeats. Then he goes back again to N1, then N2, N3, then again REM. The whole cycle repeats. In a whole 6 to 8 hours of sleep, you get about 5 to 6 cycles. So, dream is mainly seen in N3 and in REM sleep. If you want me to talk about dream alone, I can talk about it for about 15 to 30 minutes, but that is not the topic. So, let us deal with sleep apnea alone. Now, when you say REM, the full form for that is rapid eye movement, because during that deep sleep where we will not be able to wake him up that easily, you have rapid eye movements, that's why. So, you don't have any eye movement during N1, N2, N3, so it is called as non-rapid eye movement. So, in non-rapid eye movement, that is N1, N2, N3, the brain is taking rest. In REM sleep, the brain becomes active. And as the night goes on, that is early morning, like early morning 1 o'clock, 2 o'clock, the person gets more of REM sleep and less of NREM sleep. So, if a person to get up fresh the next day morning, he should get good REM sleep. That is most important. Unless the REM sleep is complete, his sleep is not complete. Now, during a normal stage of sleep, you have some changes in the body. That is, the temperature comes down, the heart rate comes down, and it stays in that particular rate. Suppose the normal range is 60 to 80 per minute, it comes down to 60, say 60, 62, and it stays in that level. The respiratory rate comes down, the whole body cellular metabolism comes down, the cortisol level, the enzyme level comes down, and the whole muscle tone comes down. It becomes less. This is what happens in a normal sleeping stage. Now, why should we sleep? What is the function of sleep? See, we have so many reasons for that, so many causes for that, so many explanations for that. Out of that, I have picked up 3 most important to explain to you. The first one is the restorative function. When the person gets a good night's sleep, what happens? He starts secreting certain hormones like prolactin, growth hormone, luteinizing hormone and testosterone. So that means if the person doesn't sleep normally, all these hormone deficiency can be seen. It goes down, the level of the hormone goes down. The second function will be the whole day he is active. So night he conserves his energy during sleep. That is the second function. The third being the memory consolidation. Whatever the person learns in the morning and whatever he feels, the brain feels that it has to go into the memory slot. The brain does this function during the REM sleep. So that's why, see, during the exam, the children during the exam, the elderly people in the house, elders in the house, they advise the children, please have a good night's sleep previous day of the exam. Why? Because whatever you, suppose the student studies the whole night and he doesn't sleep, then the brain doesn't get time to store in the allotted space, to store in the allotted space whatever he has learned. So after learning, he should get a good night's sleep to keep it in the memory slot. So that is very important. Now the fourth one is the brain activity which is going on always. The brain is active in the morning as well as in the night, even in the sleeping stage, just like how I have explained to you now. So there will be so many small damages in the brain synapses and nerve endings. So all that repair will be done in the NREM sleep. So these are the main important functions of sleep, main 4 important functions of sleep. Now coming to the topic. That was the introduction. Coming to the topic. So I will tell you 2 terminologies. One is apnea, another one is hypopnea. Apnea is nothing but complete breath cessation. He stops breathing for 10 seconds per minute. Complete breath hold. That is apnea. So hypopnea means partial breath holding. And along with that for 10 seconds, and along with that the oxygen saturation also drops approximately to about 4%. That is hypopnea. So why I am telling you about apnea and hypopnea? Because there is an index called apnea hypopnea index. With this index we can know what is the severity of the sleep apnea. So apnea plus hypopnea per hour we will make into the percentage, and that we see how much we calculate how much he has. So one normal person when he sleeps, apnea hypopnea index less than 5 per hour is accepted. But if he gets apnea hypopnea index is bit more than 5 and less than 15, it is a mild case, and more than 15 and less than 30 is a moderate case, and more than 30 of course is going to be a severe case of sleep apnea. Now when you talk about sleep apnea, let us classify the sleep apnea. So the cause for what we have done is we have spoken so far was the severity of sleep apnea. Now we are going to classify as per the cause. So the cause can be the central cause which is in the brain, or the peripheral cause because of the obstruction, so we call it obstructive cause, or it can be mixed central and obstructive. So you have 3 types: central, obstructive and mixed type. This is the classification as per the cause. Now when suppose a person has got a sleep apnea, he goes and his disease progresses slowly. So he goes into different stages. So first he will have primary snoring, where the affected person, he snores a lot. He is not disturbed. He gets a good night's sleep. But the person along with him, maybe his wife or maybe the person who's sleeping in the room, they are really disturbed. And there's another subtype called heroic snoring, where the snoring sound not only heard in the same room, but maybe it is heard in the room which is the next room and the subsequent room too. That is called as heroic snoring. So in this stage, the person snores, he doesn't know what is happening, he gets a good sleep. And there is no oxygen desaturation at all. The oxygen doesn't drop down in the blood. So when as and when the disease progresses, he goes to the next stage, which is called as upper airway resistance syndrome, where he has snoring, but he gets a disturbed sleep. He turns to the left. Then after say about 15-20 minutes, he comes back to the central position, and after 15 to 30 minutes he turns to the right. So his sleep gets disturbed, but he doesn't come to know about it. And his body oxygen saturation is also maintained. But the complaint will be, he doesn't know, but next day if you ask him, did you sleep well? He says, he doesn't give a ready-made answer like yes. He says, yes, it's okay, like that he says. But you can make out that when he gets up, he'll be tired. And he'll have like little memory loss, little concentration capacity will be little less. He gets irritable sometimes. This will be the complaints in those patients in a stage of upper airway resistance syndrome. Now, from this he goes to the final level, which is called the sleep apnea. So we have discussed now about primary snoring and upper airway resistance syndrome. Now we are going to the last stage, which is called as the sleep apnea stage, the last stage. Here you have snoring, as well as he keeps on moving in the night, and his body oxygen level comes down. So since the oxygen level comes down, his carbon dioxide level goes up and he is disturbed, and because of he get a gasping, choking, and he wakes up from the sleep. That is what is called as sleep apnea. So this sleep apnea can be a central cause, peripheral cause, or obstructive cause, or it can be mixed. So these are the stages of sleep apnea. Now, why I am classifying like this? Because the treatment also depends upon this stage. Now, in this topic, I am going to talk only about obstructive type of sleep apnea, that is mainly ENT related. So, now what happens in sleep apnea? Before that, see, this is more common in males. There are so many causes for that. I am not going into details. And there is more common in males and common in females after their menopause. And most of the patients who present with these complaints, which I am going to tell you, they are obese patients, elderly patients and obese patients. And some of them, they have a family history of obesity or family history of sleep apnea too. Now, see, I'll tell you what happens in sleep apnea. What is the pathology, what really happens and why he wakes up. So, when the patient goes to sleep, when he goes into a deep sleep, say like N3 and REM sleep, the whole muscle tone in the body comes down. So, the upper airway, it is not a rigid airway. So, behind the nose, behind the oral cavity, these are surrounded by muscles. So, when the normal person goes to sleep, the muscle tone comes down. In sleep apnea, what happens is the drive from the center, that is from the brain, the drive to make the muscles patent, to keep it dilated, is not there. So what happens? The muscle tone become more decreased. It decreases more. So that means the airway, it collapses. So when you have a collapse of airway, the oxygen supply to the body is less. When the oxygen supply is less, the carbon dioxide level increases. When carbon dioxide level increases, it activates the brain to wake up so that they can get back the oxygen. So the patient wakes up. Then he goes back to sleep. The whole thing gets repeated again and again. This is what happens. Now, the latest study says the drive, the impulse which comes from the brain to the muscle to keep it dilated, it seems that even the receptors in the muscles are destroyed. So that's why even after doing so much of surgery or exercises, we don't get a complete recovery because the receptors are gone. So whatever receptors are left behind and whatever the mass effect is there, that is what we are trying to revive. Now, the obstruction can be at 3 different levels. One is, it can be at this level, that is the nasal cavity. Another one, nasal cavity and behind the nasal cavity, which is called the nasopharynx. Second is the oral cavity and behind that is the oropharynx. Third is the voice box and the hypopharynx. Three different levels. That is what I have shown here. Nasal cavity and nasopharynx, oral cavity and oropharynx, larynx and hypopharynx. It can be at 3 different levels. Now, let us deal with each level. What can be the problems? See, the main problem of sleep apnea and the complaints related is mainly in those collapsible areas. The collapsible areas is these. The nose is a rigid structure. But what happens is most of the patients, we find some block in the nose too, which contributes to the obstruction here. So let us start discussing about the causes. The first cause will be nasal valve collapse. So each time the patient breathes in forcefully, especially during sleep, the whole valve collapses down. That is one. Second cause being the septum, the nasal septum, instead of being straight, it is bent to one side and obstructing the nose completely. That is called as deviated nasal septum. The third being, he has got polyps in the nose. The cause for that can be chronic rhinosinusitis, or it can be allergic rhinosinusitis, or it can be fungus also. That is nasal polyposis. The fourth being, there is a tissue growth behind the nose, that is in the nasopharynx. So this is what you see in the nasopharynx. So that can be another cause. Now in the oral cavity, the tongue can be enlarged. This is called as macroglossia. The palate here can be redundant and it can be redundant and loose. That is another. Tonsils will be enlarged. The whole tonsil is kissing and it's big in size. That can be third cause. These are the common causes in the oral cavity and oropharynx. And see, if they see this picture, the mandible is small and it has gone back, retracted. So what happens? The airway behind, behind the base of the tongue is narrow. So since the airway is narrow, the chances of having breathing difficulty during sleep is very high. And another common cause, it can be macroglossia, which means the tongue is big in size. So these are the common ones which I have discussed. So in this video, the part 1 video, we have discussed what is sleep apnea, how do you classify the sleep apnea, what are the different stages of sleep, what are the different stages of sleep apnea, and what are the common causes and the reasons. So in part 2, please do watch part 2. The part 2, I am going to deal again mainly of the pathology once again in short, and what are the patient complaints, and what are the findings we get on examination. Likewise, what are the important investigation to be done. So we have part 1, part 2, part 3 and part 4 also. So part 3 is going to be non-surgical management of sleep apnea, and part 4 is going to be the surgical management of sleep apnea. Kindly please see all the 4 parts to get a full picture of sleep apnea, mainly obstructive sleep apnea in adults. Thank you so much.